All right, we're going to talk about postpartum care and assessment now. If you are following along with cards, I'm on card 61, which is in the green stack. So we're first going to talk about the fundus, which is the top of the uterus. So after birth, the fundus should be firm, it should be midline, and it should be at the level of the umbilicus, which is the belly button. At 12 hours, the fundus will be 1 centimeter above the umbilicus. And then after that, it will descend 1 to 2 centimeters every 24 hours. So at day 6, the fundus should be halfway between the umbilicus and the symphysis pubis. And then by 2 weeks, the uterus should no longer be palpable because it has descended below the symphysis pubis. So in terms of nursing care, we're going to want to assess the fundus every 8 hours. We're going to assess the fundal height, the uterine placement. Is it midline or is it displaced laterally? We're going to also assess the consistency of the uterus. So like I said, it should be firm. It shouldn't be boggy. And we're going to check for that every 8 hours. So if we find that the fundus has been displaced laterally, it's not midline, then the priority nursing intervention is to have your patient void, empty their bladder, and that will likely take care of that problem. We should also advise our patient to void every 2 to 3 hours to prevent future displacement of the uterus. If the fundus is boggy instead of firm, then our priority nursing intervention is to massage the fundus in a circular motion. Also, we may be administering oxytocin as prescribed to increase uterine contractions and to prevent hemorrhaging. Also, we should encourage the patient to breastfeed because this also stimulates the release of naturally occurring oxytocin, which will help the uterus contract and also prevent bleeding. Okay, now let's talk about lochia, which is the discharge that the patient will have after they give birth. So there are 3 stages of lochia to be familiar with. The first is lochia rubra, which is a bright red color. It is expected that the patient's discharge will be bright red, will be this lochia rubra for 1 to 3 days after delivery of the baby. Then we will move into lochia serosa, which is a pinkish brown color. This will last for about 4 to 10 days after delivery. And then finally we have lochia alba, which is a yellow-white in color, and it will last for 11 days to 8 weeks after delivery. So let's talk about what abnormal lochia would be. So if you see spurting of blood from the patient's vagina, that is not expected, and you would want to notify the provider right away. If the patient saturates her perineal pad in under 15 minutes, that is excessive bleeding and also cause for concern. It's indicative of hemorrhaging. If her lochia is malodorous, then that could be indicative of an infection and should also be told to the provider. And then if she has lochia rubra past day 3, that would not be normal. And then lastly, I want to encourage you to check under the patient for pooled lochia, because sometimes that may not be initially obvious, but if you kind of lift her up and you see all this blood, then that can be indicative of hemorrhaging, and you're going to want to address that. Okay, let's talk about some postpartum care for the perineum. So first of all, we're likely going to provide stool softeners to the patient to prevent constipation and to avoid having her strain when she's having a bowel movement. Also, we're going to want to educate the patient about perineum cleaning. So after she voids, she should use a squeeze bottle that's comprised of water plus an antiseptic solution. She needs to make sure she is wiping front to back, and she wants to kind of blot dry versus like wipe, because it's going to be very tender and painful down there for a little while. Also, you can give her ice packs to apply to her perineum, which will help with pain as well as swelling. And then she can use sitz baths twice a day or more to help with pain as well. Also, you may be giving her pain medication, so this can include NSAIDs, or it could be opioid analgesics if she's had a C-section. You can also provide topical anesthetics as well as witch hazel wipes if she has hemorrhoids, because those are all be helpful interventions for pain. All right, let's talk more about breasts now and breastfeeding. So colostrum. Colostrum is secreted during pregnancy and for 2 to 3 days immediately following delivery. Colostrum is super rich in antibodies, in protein, and fat-soluble vitamins, so it's super healthy for the baby. Milk is not produced for approximately 3 to 5 days after delivery. So in terms of teaching immediately after delivery, you want to make sure that the baby is latched onto the breast correctly. So we don't want the baby just taking in the tip of the nipple in their mouth. We want to make sure they have the whole areola, or part of the areola at least, in their mouth, not just the nipple. Also, we need to educate mom that breastfeeding produces oxytocin, which helps the uterus to contract and prevents hemorrhaging. And we want her to be alert for signs and symptoms of mastitis, which include cracked nipples as well as flu-like symptoms. All right, let's talk about some postpartum cardiovascular changes that you would expect. So in terms of blood loss, if the patient has had a vaginal delivery, then we would expect about 500 milliliters of blood loss. If they've had a C-section, this will be double, approximately, about 1,000 milliliters of blood. Also, after delivery, we would expect the patient's coagulation factors to be increased for 2 to 3 weeks, which places them at higher risk for a blood clot, okay? They will also have elevated white blood cell counts for the first week. So you may see white blood cell counts between 20,000 and 25,000, which is, of course, really high. In a patient who just hasn't given birth, then you would be worried about infection, but this is to be expected after birth. So because she's at higher risk for a blood clot, we're going to really want to take some steps to prevent a DVT, or deep vein thrombosis. So we're going to want to assess her legs for signs of DVT. This includes unilateral swelling, erythema, and warmth in one leg. And we want to encourage her to get up and ambulate as much as possible to help prevent DVTs. Okay, and then lastly, we're going to talk about some postpartum care in terms of the immune system. So a rubella vaccine will be given to patients with a titer that's less than 1 to 8. And we want to advise the patient after she receives this rubella vaccine not to get pregnant for at least 1 month from the time that she received that vaccine. And then in terms of RhoGAM, we're going to administer it within 72 hours of birth to Rh negative moms who have given birth to Rh positive babies in order to prevent the formation of antibodies in the mom, which helps to protect the baby should she get pregnant again. And then hepatitis B, we give a hepatitis B vaccine and immune globulin to babies born to infected moms within 12 hours of birth. And then other vaccines we would give include varicella and Tdap. We would give those to patients who do not have immunity to those things. So that is it for this video. I know it's a lot of information about postpartum. We will pick it up with more information in my next video. Thanks for watching.